Well, welcome. I'm glad that you're all able to make it this evening, and I applaud your interest in learning about the health insurance marketplace. As Debbie said, this is Dan Walsh from the Foundation of Healthy Communities. He's a certified assister, and Melanie is also from ServiceLink, and she's also a certified assister. We, the three of us, are part of a large community of in-person assisters around the state, but particularly in the Concord area. So I'm going to give you some information when I talk about the resources on how to get in touch with us or any other people that can give you in-person assistance. But the three of us work very closely together. We share a lot of resources, and we put in enrollment time together, so we've been working very closely. So we wanted the three of us to come here today and talk to you about what's happening. So I want to announce, if you haven't heard it already, that the health insurance marketplace is open for business, and it opened on Saturday, November 15th. And the marketplace is going to be open until February 15th. That's a very important date because that gives you basically, 3 months to visit the site, or visit an assister, review what your needs are, compare the plans, do some shopping, and then actually enroll. If you would like to enroll and have sort of a seamless use of your health insurance from now, and so that it would, starting January 1st, you would need to have your enrollment by December 15th. If that is fine and you don't mind a gap, then you can wait a little bit later. But between now and December 15th, we'll give you a seamless enrollment so that your new effective date would be January 1st. So we're going to get into this about the marketplace. The way I've set up my program is that I'm going to give you sort of an overview. Deb said we're going to tell you everything you need to know. There is a lot to know. We don't want to overburden you with too much information because that can, bedazzle us. But at the same time, we want to give you some essential pieces of information that will allow you to move ahead and either work with a sister and ask very good questions that will inform you, or also to do this on your own. So the way I've set this up is that we'll do an overview of the marketplace and some of the features and benefits, and then I have some screenshots of the pages on healthcare.gov and sort of talk you through the application and enrollment process. So hopefully we'll get right into that. And then afterwards, Melanie, Dan, and myself will be happy to answer any questions that you might have, and we can talk to you about some of the handouts as well that are on the back table. So we're going to talk a little bit about the marketplace, how to lower the costs, how to actually to enroll, and whether you're eligible or not. And then we're going to explain some of the health insurance, how it works, and then identify some of the resources. So just a little bit quick of an overview. As you may remember, it's already been 4 years, but in 2010, the Affordable Care Act was passed and became law in the United States. This particular law has definitely transformed the health insurance delivery of health care in the United States, and it's given us as consumers quite a bit of benefits in different ways. So some of those benefits include no more discrimination due to pre-existing conditions. This is a huge piece, and also due to gender. So insurance companies cannot charge more to females than males. So there's no more gender discrimination. And also, we have this law has protected us with limiting coverage so that there are no annual or lifetime limits. It's provided for some affordability programs, and the two affordability programs are the premium tax credit and cost sharing reductions. Most people who go through the marketplace will receive some kind of discount program, so that's good news for most of us. The law also expanded health insurance in our state as well as many other states, and we call it the New Hampshire Health Protection Program, so that people who are below the guidelines for the marketplace will also have a place where they can find health insurance in our state. And another important factor about the Affordable Care Act is that now young people up to age 26 can stay on their parents' plan. So that has really helped the health care of and access of young people. And there are also more preventative services now available at no extra cost. So the marketplace is a new way to get health insurance, and to do that you can go to healthcare.gov, which is an online virtual marketplace. You can also access the marketplace by phone and also through a paper application, but mostly we want people to go through the online portal at healthcare.gov, and it's actually, when it's functioning properly, it works very, very well. But the marketplace is a place where consumers will find health plans that meet the federal guidelines. Okay, so this is very important because they all will have the essential benefits that create a core package. Consumers will find a choice of plans and levels of coverage that fit their individual needs. So there's something for everybody there. All right. There's information about the costs in simple terms. We won't find the same legalese that we used to see in the past. It allows for apples to apples comparison. And finally, you can actually, after you go through the comparison process, you can actually sign up for your health insurance right there. So some key benefits regarding the Affordable Care Act is that all insurance plans have to cover 10 essential services, okay? Doctor's visits, emergency room, prescription drugs, laboratory work, mental health, substance abuse, behavior management services as well. These are 10 basic core services that are covered with all of the plans that are offered in the marketplace. Again, you can get financial help through the affordability programs. There's the limit on pre-existing conditions, or prohibition, I should say. And then, of course, the easier comparison of plans. And that's really a nice feature for this year. And we have a slide that shows some of that. So one thing about the plan, about the marketplace that you probably have heard about is the individual mandate to have shared responsibility, in that everybody participates in having some kind of coverage. And the coverage that is required has to meet the minimum essential coverage criteria. Okay, that is, all plans have to have at least those 10 essential benefits. If you have a plan that meets that criteria through your employer or some other way, and I have a list of some of those types of plans that meet the criteria, you're fine. You don't have to do anything, all right? However, there are some people, for various reasons, are eligible for an exemption. And I have a slide about that. And then if a person does not have minimal essential coverage, nor do they have an exemption, then they will have to pay the shared responsibility payment or fee. So let's go into that a little deeper, okay? The minimum essential coverage type of plans include your employer-sponsored health insurance. If anybody has COBRA, I know I asked a couple people if they had COBRA or not, because if they do, you are considered covered, although it's very expensive and you can still go into the marketplace. But Medicare, Medicaid, Peace Corps, any of the VA types of coverage that a person would get through the marketplace that we're talking about, and then any private individual coverage outside the marketplace. All of those meet the minimum essential coverage, and you are basically don't have to do anything. However, A person may be eligible for an exemption, and there are a variety of reasons why a person may be eligible, including the fact that maybe there's a religious objection, they're part of a healthcare sharing ministry, and there are a number of exemptions that if you think you are eligible for an exemption, it's probably a good idea to work with an assister who can take you through that process. But one of those reasons for having an exemption is that it's not affordable. And that is the cost of the insurance, the premium, is greater than, to purchase it, is greater than 8% of their household income. All right? If that is a scenario, then a person can get the exemption and they will not be responsible for the shared responsibility payment. All right? However, if a person decides that they do not want to apply for coverage, they do not have an exemption for any of those reasons, they will have to pay a fee, the shared responsibility payment. And so that is what the individual mandate is all about, that if you don't participate for a good reason, then there is a payment fee that does have to be paid. So in the end of this year, when people file their taxes, the beginning of next year rather, for 2014, if a person did not get an exemption, then you may have heard of this already. It's the fee, or the tax, if you will, is $95 per adult, $47.50 per child under the age of 18, or 1% of the income over your filing threshold. Very few people are expected to have to do this, all right? But that is the penalty for not participating, and people should be aware of that. So in 2015, again, if a person decides not to participate in the marketplace or have any other kind of health insurance that meets the criteria, the penalty gets higher. So we just want to be aware that there is a penalty, and it does increase. But there are so many options there that fit people's needs and their budget that really there should be a place for everybody along that spectrum. So we're going to talk about that a little bit more and get into some greater detail as well. So one of the things that I mentioned is that all the plans cover the 10 essential benefits, so it's a core package of benefits that all of the plans in the marketplace have. And they're called qualified health plans, or QHPs for short. But they all have these 10 essential components. To various degrees, some of them have different co-pays and different co-insurance attached to them, but all of these different services are included in the plan. So there's some standardization there that everybody knows what they're getting when they get a qualified health plan. So for instance, you don't have to worry about emergency services. It's covered. It's part of the plan, okay? But again, to various extents, various co-pays or co-insurance will be possibly a little bit different. Prescription drugs, okay? Laboratory services, and then preventative and wellness services also. These are all part of the 10 essential benefits. In fact, the preventative and wellness services are provided at no extra cost in most cases, all right? So your physical, your immunizations, your flu shot, all of that is at no extra cost. And that's really good to know, because that's meant to keep you healthy on an ongoing basis. Okay, and as I'd mentioned, as a consumer, then what you do need to know is that that the premiums and the co-payments and the co-insurance will be different, even though all the plans carry those 10 essential benefits. But also, as a consumer, what you need to know about are the different networks that are attached to the different plans. The coverage level can vary within each plan, okay? And also, it's beneficial to review those plans because in addition to the 10 essential benefits, there may be some added value benefits and features as well. So it does behoove us to take a look at what those different components are of the plans. And also some of the plans tend to be more robust in certain areas of those 10 essential benefits. They tend to be that the companies are sort of carve out a specialty. So again, it's just kind of nice to know which areas that they tend to be a little bit more robust. So in New Hampshire, last year in 2014, we had one provider. And so we didn't have too much choice, actually. So that one provider offered 11 different plans, 10 plus the catastrophic plan. This year, we have 5 insurers. Anthem Blue Cross Blue Shield is returning again. Minuteman Health, Maine Community Options, Harvard Pilgrim Health, and Assurant Health are the 5 different insurers. And amongst those 5 insurers, all 26 hospitals will be covered by at least 3. Okay? So no matter what hospital you're talking about, at least 3 of those companies will have those hospitals in their network. So we went from one company, 11 plans, to 42 plans, and 6 dental plans to choose from within the marketplace. Okay, within the marketplace, because that's what we're talking about. So as consumers, we're going to have to be looking around a little more in depth because there is more to analyze. But basically, in addition to the 10 essential benefits, all the plans have different levels of coverage. And we go from the bronze level to the platinum level. And this year in New Hampshire, there is a platinum level. Last year, we just went up to gold. But the different levels of coverage are categories of how much the company is going to be paying for, on average, the total cost of your medical services each year. And typically, the more they're going to absorb as part of your medical costs, the higher the premium is going to be, and the lower your out-of-pocket costs. As you go down the metal level categories, you have the lowest premiums coming from the bronze plans, but then you as the consumer are absorbing more of the cost, the total cost of those, on average, of those services. So with the platinum, the insurers covering about 90% of those total costs over the course of the year, and you're absorbing 10. 80, 20, 70, 30, 60% for the insurer, 40% for the consumer. On average, the total costs. So those total costs would include your deductibles, your co-payment, and your co-insurance, the 3 of them in the course of a year. Okay? So how can you use this information? If you are a person who uses the medical services quite a bit for whatever reasons, it may be better for you to look at a high premium that you're paying every month, a higher premium, but then a lower out-of-pocket cost every time that you use those medical services, if you use them a lot. At the other end of the spectrum, if you're a person who does not use the medical, does not plan to use the medical services very much, then it might be better for you as a consumer to consider plans that have low premiums and the highest out-of-pocket expenses. Because remember, health insurance, like any insurance, is a risk. You're gambling, okay? You're hoping that you won't have to use it. So if you're a person who tends not to, then you're gambling in a way that you will have very low or none out-of-pocket expenses. But nobody knows, and that's what insurance is all about. It's looking at the risk and assessing what you think your risk will be. And we could talk about this a little bit more. But all of the plans, all 42 of the plans from the 5 different companies are divided into the bronze, the silver, the gold, and the platinum. Okay, so that's what we're going to see this year. There is another kind of a plan that is available from all of the companies, all the insurers, and it's called the catastrophic plan. And what categorizes the catastrophic plans is the fact that they are very low cost. They tend to be very low cost, but they have high deductibles. All right? So basically, what you're getting is protection against medical costs that would come out of your pocket up to a certain point. So at a certain point, the risk is absorbed, or the insurer would pay the costs. These catastrophic plans are not for everybody. In fact, you have to be 30 years of age or younger, except for those people who get an exemption from the marketplace because they have determined that affordable health care is greater than 8% of their annual household income. So by filing that kind of an exemption, which a consumer would have to prove, that does open the door for a catastrophic plan if a person is older than the age of 30, all right? But typically it's for people who are 30 years and younger. And one of the main benefits of it is that it does allow for 3 primary care visits per year. But it does protect against high out-of-pocket expenses, very high out-of-pocket expenses. The other thing that the Affordable Care Act gives all of us who are in the marketplace are 2 affordability programs. So you've heard that there are a lot of plans to choose from, and there's something that will suit everybody's budget. And what that's referring to are the 2 affordability programs, that being the premium tax credit, and the cost sharing reduction. So this slide is about the premium tax credit, and that is, like I say, that's the first program that helps to make these premiums affordable. In order to access the premium tax credit, you have to buy health insurance through the marketplace. So if you're in the marketplace, you may be eligible for the premium tax credit. So when you do your application, there are some of the questions that are being asked about your income is to determine how much of a premium tax credit you may be eligible for. So that's part of the calculations. And for this year, just to give you a range of where people fit in terms of the marketplace, to access that premium tax credit, your income needs to be between 100% and 400% of the federal poverty level. So that sounds like a pretty vague number, but just to give you an example, and we all have charts, they're kind of long, so nobody really memorizes them, but there are some numbers that we do remember, and the range between $23,850 to $95,400 this year for a family of 4. Puts a person right into the marketplace between 100% and 400% and eligibility for the premium tax credit. The thing about the premium tax credit is, like any tax credit, you reconcile with the government when you do your taxes. So the tax credit is settled at the end of the year when you complete your 1040 IRS forms. The nice thing about the premium tax credit is that you can take it as an advance. And this is really important for people to know, because the whole idea of the premium tax credit is to lower the cost of the premium to make it more affordable. But the advance premium tax credit helps your cash flow on a monthly basis. All right? So we can take that premium tax credit as an advance each month. And in fact, just the back end of it is that it's paid directly to the insurer. All right, so it's all seamless to us. We don't have to worry about that. But that is the advanced premium tax credit. So again, it reduces the amount that you're required to pay each month. and the net effect of that is that it does help your cash flow. The thing about the premium tax credit is that, and again, we can talk about this in more detail when we get into some of the application information and so forth, is that if a person's income changes, because you are reconciling when you do your taxes, if a person's income changes, either increases or decreases during the course of the year 2015, you want to report that to the marketplace. Because when you go to do your taxes, you don't want a surprise. You don't want to be paying back something that you shouldn't have received, and at the same time, you don't want to have your budget sort of be crimping on your budget all year long when you should have received more, all right? The marketplace very easily calculates the premium tax credit, so it's not something we have to really worry about too much. It's done for us in the application process. But the one thing to remember is that it is meant to help reduce the cost of the premium. But if your income changes, you do want to make sure that you let the marketplace know so you don't have any surprises. So what some people do is they use their premium tax credit completely to lower the cost of the premium each month. And if they do, this chart is just saying that if you do, you're not going to get any kind of a refund at the end of the year, which is the whole point of it. The whole point of the advanced premium tax credit is so that you don't get a refund on this particular credit. But people certainly can use part of it, or they don't have to use any of the premium tax credit as an advance. But at the same time, they're paying the full premium every single month, okay? So you really want to use that advanced premium tax because that's what's making it affordable on a monthly basis. And again, helping your cash flow so that you can meet your other expenses. The other affordability program is the cost sharing reduction. And that is meant to also lower, that's meant to, where the premium tax credit lowers the cost of the premium. The cost-sharing reductions are meant to lower the cost of the deductibles, the co-insurance, and the co-payments on those different plans. And that also has certain thresholds and eligibility requirements. And one of them is that the income needs to be at or below 250% of the federal poverty level. And again, for a family of four, just over $59,000 at $59,625. In order to get that cost sharing reduction, you must be receiving the premium tax credit. But you would be, okay? More than likely you would be if you fall into that range.
Would you,
Sure.
Would you divide that 59,000 by 4?
No.
Single?
It's
No.
Completely different. Yeah. It's based on the number of people in your household and how those resources are utilized by the household. It's a federal calculation. We just apply it. That's all we do.
Okay.
and other agencies apply the federal poverty level guidelines to their benefit programs as well. It's a commonly used guideline that's used.
So you're just using a family of 4 as an example?
I have the entire chart. We all carry the entire chart. We have a family of 1, 2, household of 8.
Okay.
Yeah. And we can show you what that is at the end.
There's a tool on healthcare.gov that we can show you that you can enter in, different individuals, like how many individuals in your family. If you have 4, enter your household income, and then it can give you an estimation of what type of premiums you're going to pay and what type of deductibles you're going to pay.
Right. So the other thing that I want to say about the cost sharing reduction program is that the consumer will want to, but you will need to, in order to use that cost saving reduction, you will need to enroll in a silver level plan. But you'll want to because you're getting greater value, again, at a more affordable price. So it's a very desirable thing to actually take an expensive plan, typically an expensive plan, which is the silver level plan, have those cost sharing reductions applied to make that particular plan very attractive and very affordable. And again, there are some people, there are some groups that can utilize the cost sharing reductions without having to meet the 250% level of federal poverty level, and that is federally recognized Indian tribes. So if a person has a card and is a member of a federally recognized Indian tribe, they have a slightly different criteria. So there's one other thing that you may have heard about that tends to muddy the waters a little bit, but not too much. And that is when the employer offers health insurance. If the employer health insurance does not meet a minimum value of that 60% total cost average being covered by the provider, and the individual plan that's being offered by the employer exceeds 9.5% of the entire household income, okay, then that employee and their family can go into the marketplace and use and access the premium tax credit. Otherwise, employer-sponsored health insurance always trumps the marketplace. Okay, so if you have employer-sponsored health insurance, that is going to trump the marketplace unless the employee's share of the premium for an individual plan exceeds the 9.5% of the household income. All right? So there are a lot of occasions where that can be a problem, because when you start purchasing or looking at a family plan and the entire household income, this guideline doesn't apply. Okay? So the family, so I'm getting a little confused here. So the family would have to, the entire family would have to go onto the plan, which would make it possibly, seemingly not affordable, but according to the guidelines, it's still affordable. Okay, so I got that right. And there's a tool that you can use at healthcare.gov, we always use as well, to help determine that whether the individual plan is below the 9.5% household income, and it's called the employer coverage tool. And that's something one of the assisters can help you with as well. So in New Hampshire, not only do we have the health insurance marketplace with the qualified health plans within that marketplace for us to access, but we also now have the New Hampshire Health Protection Program, okay, or plan. And the criteria, so if you think of the different options as a long continuum, a sliding scale, the marketplace is available, the 5 insurers in the marketplace are available for people who fit that 100 to 400% federal poverty level, but people below that 100% federal poverty level, or actually it's 138% now, but we have the expanded Medicaid New Hampshire Health Protection Plan available for families in that end of the continuum. To be eligible for that, you need to be between the ages of 19 and 64. Why? Because at 65, for the marketplace or the New Hampshire Health Protection Plan, you would then be looking at Medicare, okay, which is a whole different type of insurance. But again, it meets the essential minimum coverage, all right? To be in the New Hampshire Health Protection Plan, again, as I was just saying, the income level needs to be at a certain threshold. Otherwise, you're in the marketplace, which is where you want to be. But again, if you're below those thresholds, then you're in the New Hampshire Health Protection Plan, which is where you want to be, because you're going to get a little bit more help if you think of this as a sliding scale. Again, those plans cover the same, similar essential benefits, from emergency room to doctor visit to specialists to substance use disorders and more. The 2 companies that are the insurers, 2 different companies, are WellSense and New Hampshire Healthy Families. So we have those 2 companies for the New Hampshire Health Protection Plan, and then we have the 5 other ones for the marketplace part. not to go into too much detail, but within the New Hampshire Health Protection Plan, there are actually two programs. There's one program that helps to pay for your coverage, again, if the guidelines are met for income, if you work for an employer. Because as I said, employer-sponsored health insurance always trumps the marketplace. But if an income meets that certain threshold of the New Hampshire Health Protection Plan, and you are working, you can possibly get some assistance there, which is great. If a person is not working, and again, meets the income thresholds for the New Hampshire Health Protection Plan, the other program is the Bridge program, okay? And again, you would apply for that, and you would get your card, and you would select one of the two insurers. So how can somebody find out about this? For the New Hampshire Health Protection Program, you can work with an assister. You can call the Department of Health and Human Services district office or work with the assisters, and we're going to give you a resource on how to find all the assisters around the state. You can also go on to newhampshireeasy.nh.gov yourself, or again, you can go on to healthcare.gov, and that will take you over to that part of the marketplace or that part of the spectrum. All right? And then there is a phone number. You can talk to somebody at the help desk at 888-901-4999. And this kind of gives you some of the guidelines. So the monthly income, if your monthly income is for a household of 2, or again for a household of 4, about $27.43 on a monthly basis, it probably is worth your while to see if you would be eligible for the New Hampshire Health Protection Program, or one of the two plans. So eligibility and enrollment, okay, to apply for the marketplace, you need to be a citizen of the United States or lawfully present. You cannot be incarcerated. And to apply for a particular plan, you need to live within the service area of a particular insurance company. So when you take a look at the plans, when you apply, the providers for your area, for your zip code, will automatically populate and show up. So you'll be able to select from that. But if you have moved outside of that area, and people do move around, then there's a good, especially if you're moving from out of state, you will have to select a different company, a different insurer. So this is new, is renewal and re-enrollment. So for those people who found themselves a plan within the marketplace last year, now's the time, as of November 15th, to renew and re-enroll. And you want to do this because last year we didn't have it. We didn't have a selection of plans, and this year, as I said, there are 42. So you may find something that is actually more affordable, and you might find something that meets your needs and has some different values, different features and benefits that add some value to that would be pertinent to yourself. So you do want to go back to the marketplace. You do not want to just self-enroll. You can self-enroll. You can just let it automatically enroll for you. But the problem is you may be paying for something that you, how would you say it, not necessarily be needing. Mm-hmm. And also, when you automatically enroll, the marketplace is using last year's information. This year, you might be eligible for increased advanced premium tax credit. Or you might, because if your income has increased this year, maybe you would not be eligible for what you received last year. So if you are renewing, you absolutely want to go into the marketplace, take a look at the plans, and go through the almost re-enrollment so that the marketplace is recalculating what you actually should be getting for this year. Again, if you use last year's numbers, they might not be pertinent to you. All right? So that's really the crux of this very dense slide. So there are 4 ways to get assistance through the marketplace: over the phone, online, in-person help, which we represent, and by doing a paper application. And really the best, and in some cases you might be using all 3 of them. You might be going online, you might be working with an assister, and you might have to have some questions answered by phone. But the most efficient way to get your re-enrollment or enrollment really is to go online to do that, as opposed to a paper application. So we have some in-person help. There's quite a variety of help available to people. The 3 of us, Melanie, Dan, and myself, represent certified assisters, and I think the key word there is certified. Although we have slightly different designations, I happen to be what's called a navigator. Melanie and Dan are marketplace assisters. The hospitals and our community health centers have assisters who are called certified application counselors, okay? But the key word is that we're certified. To find an assister in your area, okay, the easiest one-stop shopping place to go is Covering New Hampshire. And I have the webpage right here so you can see what it looks like. And in the sort of across the ribbon there on the right-hand side, there's a button that says Get Help, so that you can just sort of hit that button and you'll find there'll be a map there with all the different assisters. But also at healthcare.gov, there's a search area there. It's called Local Help, healthcare.gov, so you can put in your zip code. Findahealthcenter.org, same thing. You put in your zip code and you will find in New Hampshire the different assisters. In addition to your certified assisters, there are certified brokers and agents, okay? And again, to find a certified broker or agent, the best place to go to is Covering New Hampshire, or you can go to the New Hampshire Department of Insurance, and there is a listing there of a broker. Why would you want to go to a sister over a broker or a broker over a sister? Is that the brokers can actually give financial advice. They can make a recommendation, okay? You may want to develop a relationship with them for other kinds of insurance, but they can tell you what you need to do for you. Whereas any of the assisters can provide education and information and help you go through the decision-making process.
We can't recommend a plan for you.
Can't recommend. So if you're looking for some nuances about the benefits and a deeper dive into some of those benefits, certainly an agent or a broker would be a good place to go. But again, you'd want to make sure you're working off of somebody who's certified and off that list, because your other brokers who are not certified would not be able to help you out. And they probably don't have the training or the knowledge about the plans.
And we're federally trained, whereas the brokers are, they're certified by the state of New Hampshire.
Right. I already mentioned about, whoops, going wrong way. So I already mentioned a little bit about the enrollment period, now till the 15th of February, but for a seamless transition into your new plan, you'd want to make sure that you're enrolled by December 15th. I have a checklist in the back of the room. You can pick that up with you, but some of the information that you're going to need when you sit down to do this yourself, or if you're going to work with an assister, is obviously your social security numbers, birth dates of all your family members, pay stubs so you have an idea of what your income will be so you can make some projections, because the marketplace is based on projecting your income, okay? But it goes back and it looks at the past year, okay? But you want to make a projection of what your income will be. So by having that kind of information, financial information with you, it'll help you to make a better decision. And if you have any previous health insurance through an employer or whatever, it's good information to have that with you as well. So, go ahead.
Just a question. Would it just be, why is it just use
Your tax.
2013 income tax as
Yeah.
you did in 2014 and
Yes.
try
Yes,
to estimate out?
yeah,
Correct.
right. So it's all self-attestation, okay? So it's based on, what you're saying, okay? But then the way the marketplace works, it goes back and it just kind of corroborates what you're projecting. And it's going to take a look at your information it already has from the IRS. It's going to look back, and if there's a big difference between what you're projecting and what you're actually showed for the last year or so, it's going to question you. You're going to have to prove it. It's going to come back and say, we need some further documentation. But the reason why, I do want to come back to this one thing, just because you brought it up, and that is you want to make sure your projection is as close as possible, because your discounts, your affordability programs are going to be based on that. And if you're projecting too high, you're not going to get perhaps the affordability discount that you really should be getting. But if it's too low, then of course you're getting something that you're going to have to pay back. But the way to work around that is that when you notice this big difference, you can report the change, so you don't get that surprise a year from now when you file your taxes.
But it's
So-
better at this time to use the previous
Yeah.
and don't attempt to project out.
I would use the previous, and I always add maybe 10% or, I'd add a little bit more, but it wouldn't make it.
As long as you think that that is going to replicate in the next
Yeah.
year, I mean, you have to make your best estimate.
Make
So,
your best
I
estimate.
mean, if you're somebody who is self-employed
Right.
and you're going to fluctuate a lot, and depending on the conditions, it's actually most difficult for people who are self-employed, because their income tends to fluctuate much more frequently. So, but for somebody whose income doesn't fluctuate as much, the likelihood of using your 2013 is a much better bet.
Yeah. Right. So just kind of run through a few slides that I have left here that really show the pages on the healthcare.gov and kind of walks us through very, very generally some of the steps. Basically, the steps involve creating an account, then actually going through the application, which is streamlined this year, so it's supposedly a little bit easier for us. Then the fun part of picking a plan, and then actually hitting the button to enroll. So I can take you through some of this. It's not the greatest, it's fine on my screen. It looks a little dark here, but the top left-hand corner gives you an idea of the screen that you'll start off with. And there's a red arrow there that says, select your state. So you're going to, select New Hampshire, and then it's going to start bringing you through the enrollment process. First thing you're going to have to do is create an account. This year it's a lot easier. One of the things that you'll be using is an email address that's going to be your user ID. You're going to create some security questions, okay? And then you're going to, it kind of tells you, the marketplace is telling you if it's a strong password, a strong user ID. It's going to look for any typos. So some of this is built in to help us sort of self-correct without having to go back and searching for what you did incorrectly. You're going to hit create an account. It's going to send you a message. The first little box there is going to send you a message that we've sent you an email, and it's going to direct you to your email account. Just kind of make sure you are opening up this this email saying that somebody's opening up an account in your name. There are some nice little features this year where it's you can go directly to the common, either Gmail or Yahoo or some of the other common email systems without having to leave the website. So you're there, you can just take the link and it'll take you right to your email. You're going to open up your email and you're going to confirm that you got a message saying that somebody's opening up an account where the red arrow is up there. You're going to click it because yes, you are opening up an account, and then it's going to let you know that it's thinking by telling you to please wait for a moment. And then it's going to say, yep, you did it, okay? And that's just creating the account. Then you're going to you're going to log into the account, okay, using your new username, which is going to be your email address, and then the password that you created.
Make sure to write down your password.
Yes.
Keep it in a secure location.
Right.
And write it down because it is case sensitive, so make sure to.
And also the security questions.
Right, and the
Yeah,
security
yeah,
questions.
Exactly.
You were required to change your login, your password,
Yep.
and I would have been lost.
Oh, in April, yes. A lot of people, yes, in April they required that. Right. And a lot of people forgot to they made the change, but they forgot to write it down. That's going to be a very interesting scenario when we work.
Yeah,
Yeah.
and we have sheets in the back there that allow you to just record all that information. You can take it home with you.
So these are some slides that are directly from our training curriculums. But so there's a fictitious family, Miles and his family. But what this is showing you is that when you go in and you've created your account, you have two options. You can apply for insurance for yourself and your family, or if it's a small business that's going in. You're not a small business, so you're going to go in the direction of applying for health insurance for yourself and for your family. Again, you've created the account, you confirmed that, but now we have to do an identity verification of the person who is making the application. So there's going to be some questions that will help the marketplace verify your identity. And it's basically contact information, which then gets verified. Okay, so I don't have every single slide here, but I will tell you another slide then pops up and asks you to verify. It's sort of a true-false. It's or multiple choice, I should say. It's really a multiple choice. You're going to put your contact information in. The database is going to come back and then ask you to verify several options of information about you, and you need to select the correct one or the correct ones. All right? And once your identity has been confirmed by the marketplace, then you'll be able to proceed and actually start with the application. So if you take a look at the red bar there are several aspects of the application that you're going to answer questions about. And I didn't provide you with all of those slides because it would be taking too long. However, there's going to be some questions about privacy, contact information, if you're getting help. Do you want help paying for coverage? In other words, do you meet the thresholds, the guidelines for the premium tax credit or the cost sharing reductions? It's going to want to know a little bit about who's getting the coverage. And then at each of these different points in the application process, there is a summary section. So this particular first part is about the household. It's about the person, or the applicants, I should say. The next part goes into the family and household. It's going to ask about the different members of the family. One of the questions out of several questions there in that section is the person planning on filing his taxes? In order to participate in the marketplace, you have to file your taxes. You have to file taxes. But that's fine. And why? Because there's that reconciliation with the premium tax credit, right? So it's going to ask you about that. It's going to ask you, there's a whole section on income, which is why you want to know, have an idea of what your income will be looking forward. It's going to ask you if you have some additional income sources, so it sort of tweaks you and reminds you if you have some income in these different categories, because it wants to add up all your different sources of income to see what you actually are eligible for. There may be some deductions that it's going to ask you about, such as a student loan. There will be a review. In this case, Miles has some income from Walmart. Did I see on there? I think it says Walmart somewhere. Yep. And Social Security benefits. So there's going to be a review. There are many opportunities to review your information and many opportunities to edit and make changes along the way. Eventually, after you've talked about the income, you've added information, additional information, you're going to review and sign. There are a series of other sort of privacy statements and statements that you understand the marketplace will be utilizing your personal private information, okay? So you agree to that. Then you eventually electronically sign, and submit your application. Almost immediately, you will get a notice at the bottom that says that your eligibility results are available, and this is what's going to give you information about your premium tax credit, okay? This is a very important notice. This is the one that you're all waiting for when you do this, all right? So that pops up as a PDF file. You get to read that. And then you get to do the fun part. And that is going in to look at the plans, compare, and eventually enroll. And that's, I wonder if I lost something here. Okay, so once you go in and you take a look at the plans, along the way, there's some to-do lists, little checks, reminders of things that you need to do along the way, and the marketplace will prompt you. One of the questions will be about your use of tobacco, okay? Because that is assessed a little bit differently in terms of the premiums, all right? So somebody who is a tobacco user will be charged a higher premium than somebody who does not use tobacco. So just be prepared for that.
Although there are some companies that don't
that's right.
discriminate on
Yes.
tobacco use now.
Yeah.
Anthem did last year in the open enrollment, and I believe they still do this year.
Yeah.
But Maine Community Health doesn't discriminate on tobacco use,
Use.
and I
That's
think
the
it
only
would
one.
be that's the only one.
Yeah.
Yeah.
So that's good. That's good to know. But you just need to be prepared for that question. In this case, our applicant is going to decide if he wants one plan to cover the entire family, or if for some reason he needs more than one plan. Okay, maybe he's looking at one plan and his wife is looking at another plan. Adult children looking at a third plan because they go to college out of state, and they need to have a plan that will allow them an out-of-state network. So there's a lot to think about. One of the things that you'll be able to do as a consumer is that once you put in your information, there'll be a place where the plans pop up. You'll have a summary of them. You'll be able to compare them, up to 12 plans. So there's a very nice comparison tool. You get to play around with that. You'll be able to dive a little deeper and go into the details of each of the plans, and as you can see, you can still do some comparisons. And then at that point, once you've had a chance to look at what you have available to you, you will actually choose a plan. And it's not very good up here, up on the screen, but on mine, there's a green button with the arrow there, and that actually says that's the plan he's going to pick, and he's going to enroll. Again, there's a couple of slides where you are agreeing again to the plan. You then you confirm that you are signing electronically, and then you submit it. The plan, that information is sent directly to the insurer that you have chosen, and from that time forward, you're going to be dealing with that particular company, with one of those 5 companies. So the marketplace contacts the plan, and you actually I don't know if all of them, but you may have the option of paying directly, making that first payment right there and then if you have a credit card. Otherwise, you'll need to wait approximately a week. Usually takes about a week, that was what I have found. And the company will contact you. And if you haven't been contacted by your company in 7 days, you do need to contact them.
They provide all that information there, the phone number, your application ID. So
Right.
you'll be able to contact them. You have that resource.
It won't say congratulations, but it will say you are now enrolled. So it brings you through the entire process. The marketplace will bring you through the entire process and will actually let you know that you are enrolled. If you don't get that message, then you're not quite there yet. All right, so you want to get that final message that you are enrolled. And as Dan was pointing out, you'll have another sort of a card there that will indicate the plan number and the number who's enrolled in that particular plan, and again, the premium that you will be paying. So that's it. Not that hard. It may seem that way, but it's really a lot easier. It's designed for the consumer to sit at home and to do this. But obviously, people are going to have a lot of questions. People have complex families. They have complex situations that come up. And the marketplace does accommodate them. It's just a matter of thinking through how the marketplace will do that. So there are some resources. The most important resource, I really is not probably in order, is the health insurance marketplace itself. Going to healthcare.gov, the consumer helpline, 1-800-318-2596. Very good resource for getting help directly from the marketplace. Covering New Hampshire, in New Hampshire is our official sort of site, if you will, that provides information about the health insurance marketplace. Certainly, if you have questions about the New Hampshire Health Protection Plan, 1-888-901-4999 is the number to call if you have any questions about that. People may have questions about Medicare, and although somebody who is 65 or over, Medicare is a whole different different insurance process. Certainly giving them a call, especially if you are going to be turning 65 sometime in 2015. You want to start that process of transitioning over to Medicare and start getting your information a couple months in advance so that it's a smooth transition. New Hampshire Department of Insurance, you should know, they have a hotline for complaints, fraud and appeal process. So that is a handy number to know. And then, of course, you can sign up for Twitters and Facebook information and email alerts that will let you know what's going on in the marketplace. So, just almost an hour, I'm sorry. A lot to cover, but just some key points. With the Affordable Care Act and the marketplace, you have increased consumer protections and transparency. You will more than likely be able to get some financial help through one of the two affordability programs. There are a lot of options this year, so it does really pay to assess what your needs are, get an idea what you're looking for, and then shop and compare compare the prices as well as the plan's benefits. And also, if you think that your income is within the threshold of the New Hampshire Health Protection Plan, definitely pursue that, because that just makes it more affordable and you're still getting very good quality health coverage. And I think that's it. So just remember those dates. So if anybody has any questions, the three of us, will help to answer
I
them.
do want to show the calculation.
Oh,
tool,
okay.
too.
I think it's done. Okay.
So there is a tool on healthcare.gov if you want to just get a quick estimate. Let me just pull it up here. All right,
There
so
you go.
this is
Great.
This is healthcare.gov
Live.
live right now. So you can see the start page, as Marilyn talked about. You've got your login toolbar right up at the top there. So if you do have an account, you can just click there. But there is a nice tool here called See Plans and Prices. So if we click on that, all right, now we're just going to browse for our coverage options. So let's say you want to just get a nice quick estimate. So we're in Concord, so we'll type in our zip code of 03301, and we'll press Get Started. And then this just says, please note this plan is a preview and price estimator. It is not an application for marketplace coverage. So we'll just press continue. You know, these details may change. And then, so now we're just going to enter our household income. So let's say we have an individual who is making, let's say, $25,000 a year. All right, for 2015, they expect to make that. And let's say that person is, let's say they're 31. Okay. And, you know, right here there are options to put, like, you know, are you a smoker? Are you a parent? Are you pregnant? Do you already have health coverage from an employer, Medicaid, CHIP, or Medicare? Let's say this person doesn't have any of these options, so we'll just press Add a Person. And then if there was another person in that family or household, we can keep adding those people. So if you have, you know, a spouse or children, you can keep adding them. But for our sake, we'll just do a single person. And so to do that, we'll just press Done with this step. If you want to remove people or edit, you can just press the Remove button and edit these people. So we'll just press Done here. And so now it says your estimated eligibility results. This household may be eligible for $82.04 per month premium tax credit to use right away to lower your monthly premiums. So that means that every month you would get $82 applied to your premium. So, you know, your premium is going to be lower by $82 there. You also may be eligible, as Marilyn talked about earlier, for the cost-sharing reduction on a silver plan that reduces the out-of-pocket expenses for deductibles, co-payments, and co-insurance. So now we can just continue to plans. We press that. And so this just goes to what Marilyn talked about earlier about 3 things to know about the marketplace. It covers all those essential health benefits that she talked about earlier, doctor's visits, prescription drugs, etc. So we'll just close out of that. So now you're into the plans here. So as you can see, there's 39 health plans up at the top here. And it ranks them by monthly premium, and you can also change this and do it by deductible if you wanted to. But you can see this first plan here is Minutemen Health, and that estimated monthly premium is $89. This is a bronze plan HSA, and you can see that for you're paying $89 a month, and it's for one person covered. Now it shows here at the bottom what it cost originally, which was $171. So because of your $82 that tax credit that you got, it reduced it down to $89. And now you can see that your deductible is $5,800. So as Marilyn talked about earlier, usually the lower the premium, the higher the deductible is going to be. And another thing to notice here is the estimated out-of-pocket cost. So with these bronze plans, you're going to pay a lower premium, but your out-of-pocket costs and your deductibles are going to be higher. And if we just, you know, there's a lot of tool buttons here. So on the left here, you can narrow your results. You can do less than you can find plans by the premium that are less than 100, less than 200. Let's see here.
Can you just scroll down and show them the summary
Sure.
of benefits there on the
Let me go
right-hand
back
side?
Yeah. So if we just go back to this plan here.
There you go.
There we go. That's not the right. So by monthly premium. So here's that first plan that we looked at. So if we just scroll down here, it goes into the co-payments, co-insurance information, the summary of benefits. If you click that link, it'll take you to a document that will go to the summary of benefits. It'll give you the plan brochure, the provider directory, and this other button here. You can it'll take you to a page that will expand the plan information, and it'll talk about things like are X-rays covered, you know, what specialists. So for instance, cost for medical care, it goes into much bit better detail for that. So a specialist visit would be 10% co-insurance after your deductible. Routine eye exams are no charge. Prescription drug coverage. Access to doctors and hospitals, so you can go to those links there. Hospital services, children and adult dental coverage, medical management, and a lot of these other services that Marilyn talked about. And if you like this plan, let's say you go home and you start searching through these plans and you find one in particular that you like, you can say, like this plan, take the next step. And then great, you found a plan that you like, make sure you print it. And it'll just take you to the next steps here. So if you really like this plan in particular, you can create an account, and then that will take you to healthcare. That will enter you into that process that Marilyn talked about earlier.
When you're taking a look at the plan, detailed plan information, one of the things that people will really want to take a look at this year is the network, the directory, the provider directory network. That's really important because while most providers are included in multiple networks, that's true. Maybe the one physician that you're interested in may not be in a particular plan. So you really do want to check that and not take that for granted.
Yeah.
Any other questions? Okay.
So that's where you find out if, say you're looking for something specific to Concord, this provider, this hospital.
Right.
You'll still have to go through
Yes.
each individual.
Right.
Mhm.
Exactly.
That was my question, if they had set it up where you could just put in the zip code and it would say, here's all the providers that will specific to your area.
Right. No,
Yeah.
for each company, if you went to Anthem, actually that's how Anthem worked this past year. You could put in your zip code and it would tell you for that particular zip code, but that was one company.
Well, Anthem was very clunky.
Well, it was.
To try and figure it out, when I was trying to figure out who I wanted, providers was coverage, Anthem was, it wasn't very smooth.
I know they have the Find Your Doctor tool on their website. Was that what you used?
Pardon me?
Did you use the Find Your Doctor tool on Anthem's website? Did you?
Yeah.
Yeah. See, that's what they use. Most of the other insurance companies have some sort of tool like
Yeah.
that online.
Yeah, but I find they're very clunky.
Mhm.
Right.
But so you
They
still
are.
have to, when you look at the plan, you'll have to go look at the provider for that specific.
Right.
Not provider, but healthcare.
So one thing that you might want to do, if you can find who the issuers are for, the Concord area or wherever area you're from, you could go to those 3 or 4 sites, do what you did for Anthem, okay? As you said, it could be clunky, but as Dan said, each of those companies will have their own similar find a provider, or you can go through the window shopping experience and then go into the link that's indicates what the directory is. So they're both going to take a little
Yeah.
time.
Yeah.
They're both going to take a little time.
Oh,
Yeah.
As long as it's more streamlined, last year wasn't very,
Yeah.
No, it's
the shopping for the providers wasn't that streamlined.
Mhm.
you're still going to have to search.
That I don't mind, as long as it's
Yeah.
easier.
Yeah. But going to those links, and the other thing I wanted to say too is that the different plans or the different issuers will have different formularies for the prescriptions.
Yeah.
For the prescription drugs. So if a person is taking some very specific medications, that is a link that you're going to want to also take a look at, in addition to finding out if your physician is in the network that you're looking at. So I hope we didn't thoroughly confuse you. There's a lot of information. And, if you have that sort of, bedazzled look on your face or glazed over, definitely reach out to the assister community. And if the assister community, we know our boundaries. And if we find that, you still need more in-depth recommendations, then we will help you find a broker who can really give you that final recommendation as to what to do. But if you wanted to give it a try, we totally encourage you. The marketplace is set up so that people can do this themselves and try to get through the process themselves. But we're here to help you as well. Yes?
So we don't have to have be effective for a policy as of January 1st, open enrollment through February 15th, that makes us enrolled as of March 1st. We're allowed to go as late as March 1st.
Yes, but remember, until you're enrolled and you have an effective date, you're not covered.
Yeah, I know
Well, yeah, I know. So you need to have, so if that's true and you need some more time to think about it, you probably need to have a plan B in your back of your head as to, what you're going to do or where you would go. I will say I don't recommend this, okay? So you can enroll in a plan, you create an account, enroll in a plan, pick a plan and enroll, and you have a very short window of opportunity to change your mind and pick a different plan, okay? So if you enrolled by December 15th, before December 15th, and that plan becomes effective January 1st, you still have 2 weeks in there to go, buyer's remorse, you want to change to something else. But you know what? I wouldn't do that. Because, only if you need to. You should know that that's a backup plan. It's really important to try to get there and get that effective date January 1st if you can.
And especially if you become eligible for employment and for an employer plan, you can cancel any of these plans at the end
Yes.
of any month.
Yes, you can cancel anytime. There's 2 ways to do it. There's the one way is to let the marketplace know, and then they'll let the insurer know. But then obviously you don't have to make the payment either. I mean, that's going to cancel it automatically. But it's faster to get that paperwork done by just letting the marketplace know, I have an employer-sponsored insurance now.
Going through the marketplace, my husband's on Medicare and I'm only applying for myself, but they're asking for household income and eligibility. So what do I include, what don't I include with that information?
Well, you're going to be a household of 2.
Yeah,
You file jointly?
no,
Oh, okay. So, so you don't file jointly?
no.
And you file your income taxes jointly, you don't, you say? Okay. Well, I think that's an opportunity to sit down with the assister and go through some of the, logistics of where you fit there. There's going to be a place for you. There will be a place for you. But the marketplace, does want to find out how many people in the household, because that means there's a certain limited number of resources that have to go to more people than just one. It goes 2, 3, or 4, or whatever. So it's going to ask those kinds of questions. But, I think that's a great opportunity to sit with somebody or call and find out,
What's an insurance, and I'm still confused.
Well, there's a lot of it's tied to the IRS rules. And so anything that's tied to the IRS is going to have a certain level of complexity that we all have to kind of think through. But I do want people to understand that the whole health insurance mandate, if you will, the marketplace, is one long sliding scale. There is some place for everybody. If you're over 65 and over, you have Medicare. If you're between 19 and 64 and you meet the thresholds for the marketplace plans, the qualified health plans, there's a place for you and you're going to get some assistance. If your income is at the other end of the scale, you're going to get more assistance. And so everybody is going to find a place, and most people will have some kind of assistance to make it affordable, and that's a good thing. Of course, once you get your health insurance, you want to make sure you're paying for something one way or the other. You want to make sure you're accessing all the benefits, particularly the wellness services, immunizations, your annual physical exam, and that kind of thing. You don't want to have that card just sitting in your wallet looking pretty. You really want to use it because that's going to benefit you in the long run as well.
Yeah, a lot of these plans have smoking cessation services,
Yeah.
so you really want to utilize that as much as possible. So,
Yeah, and other kinds
other
of benefits.
kinds, yeah, other wellness programs,
Chronic disease management.
chronic disease
Yep.
management, behavior management. The list goes on.
Right.
Do you know if there's a similar place on the internet for the comparison shop with the Medicare supplementary plans? Side by side like there is on the marketplace
Oh,
with
yeah.
these other plans?
Yeah.
Mm.
Yeah.
It's even
Medicare
more
side or-
sophisticated than this.
Yeah.
Yeah, for Medicare.
Melanie is from ServiceLink, and ServiceLink, if you want to stand up and just say something about, even though Melanie is a certified assistant for the marketplace, her colleagues at ServiceLink work with the Medicare population.
Yeah, the Medicare open enrollment goes until I believe December 5th. And they're going great guns right now at our office doing open enrollment for Medicare plans. So 228-6625 for ServiceLink in Concord. And we get people scheduled and go over all the different assistance plans for Medicare. 228-6625. I myself don't do that, but everybody else in the office does.
Okay.
Right. That's another specialty. It's another hat to wear.
Absolutely, yeah. And their tools to determine which plan is best for Medicare supplements are even more sophisticated than this.
Because, the supplementary program, I don't know the difference between a supplementary, advantage, complete.
I don't either, but they do.
Okay.
Get it from the
People in
experts.
next offices to me do.
Yeah. November was a month for going through insurance choices and closing out the sturgeon.
That's right. Exactly.
So, great.
Let me just show the Covering New Hampshire website.
Oh,
real
that's a great
quick.
one.
So, Covering New Hampshire .org.
There you go.
So,
Same man.
this is the website that gives a little bit of information about the health insurance marketplace. I mean, when you apply, you want to go to healthcare.gov. But this Covering New Hampshire is really specific about getting in-person assister help. So if you want to get help, you can just go to the Get Help page here. And let's say you want to find an in-person assister, find an insurance agent or broker, or events or
Right.
other resources. So they have an events calendar. If we click on that, you can go day by day. So let's say you want to go sign up tomorrow. So today is the 19th, 18th.
Look at all the events.
So
Right.
it's got all the events. Let's say you want to go to
Concord.
Concord. You can where's Concord tomorrow? So if we press the Concord button there, it'll take you down. So tomorrow we have someone at the Concord Hospital Smile Building on 49 South Main Street. It's got the phone number here to make the appointment, to schedule an appointment with an assister. So you've got a lot of resources at your fingertips, and as you can see, I mean, there's places all over the state. Every day there's some place where there's an assister going on. So you've got someone there to help you, and I would definitely utilize that resource. But they've also got the insurance help for finding an insurance agent. If you're in a zip code, like let's say you're in Concord, 03301, it'll pull up a list of all of the brokers in our area. So this is just a list of
That's a short list. There's
a
a
short list. Yeah,
show more.
yeah. If you want to show more, you can do show
Right.
more.
And
so
these
it's
are the
got
brokers
their
that
name.
are trained specifically in the marketplace.
Yes, they are certified by the state of New Hampshire Insurance Department. So
To do the
to
marketplace.
do the
Marketplace,
marketplace,
specifically,
yes, specifically the marketplace. So that's just another resource I wanted to throw out there. Let me find in-person assister. Let's see what that is. So, we also have a map. So if you are more visual, we've got a map here. So if you go, you can just kind of scroll in. They've got a nice Google map here. So, as you can see in Concord, and you click on number
Merrimack.
38 or Merrimack, it takes you there. These are all the places that you can, make an appointment with someone. They've got Bi-State, ServiceLink, and a bunch of other places. So you have options.
Right. Actually, a very good number. I would go back to the Concord Hospital. Has that, like as Dan was saying, they have an office, and we're all putting in hours there because it's such a centrally located spot. But it's next to the Gibson bookstore, and right on the main floor. You just make an appointment, you come in. It's great, very convenient, easy
Yes.
parking.
We have someone there Monday, Tuesday, Wednesday, and Thursday for
So.
3 hours. So
So what do you think? You ready to go do this yourselves?
Yeah.
Yeah, go ahead.
In an emergency, if your hospital is 20 miles away and it's the only hospital that's in your network, can you go to your local hospital instead?
You go to the closest hospital in an emergency. Don't
Right.
even think about it. You
Right.
just tell them it's an emergency and you go to the closest hospital and your insurance will cover it.
Okay.
Yeah.
That's pretty much the word in the country, right?
Yes.
Yes,
Yeah.
yes, correct.
Well, thank you very much for your time. I hope we answered some
Thank you.
questions, and good luck to you.